the specific dollar amounts and the pursuit of those, each one of those initiatives is included in the packet. The increased nursing home funding prioritizes elderly and helps to support nursing homes by providing ongoing funding to increase their Medicaid reimbursement rate and establish a special grant for rural nursing homes. The increase in access to primary care and preventive services is backfilling temporary funding that was made available through the ACA to provide an enhanced reimbursement to primary care providers. That funding has gone away. The administration is proposing to continue to fund it so that primary care providers can operate effectively to avoid unnecessary hospitalization, to decrease ED visits, and to manage care at the local level. Funding for the services related under the consent decree. The budget fully funds services required under the consent decree for mental health services and includes additional funding for Bridge Rental Assistance Program, or BRAC, to help former mental health patients live independently. The initiatives related to Riverview Psychiatric continue. There clearly were a significant level of enhanced funding and physician increase in the FY15 year, and those go forward and continue with additional positions in 16 and 17. The Well, I just want to make sure I also have, I forgot to mention the wait list, the effort to buy down the people that are on wait lists, thousands of mayors who are on wait lists for home and community-based services, and these relate to the Medicaid waivers, section 18, 19, 20, and 21. Clearly a major priority, great deal of discussion about the eligible but unfunded individuals that are on these wait lists, now receiving a significant amount of additional funding to provide, to essentially draw down and the people on wait lists no longer receiving services.
Do you have questions?
Yes, thank you very much, Mr. Chair. Just a quick question. Are there any assumptions here based on Riverview funding, whether it might come back or just being built without that, or what assumptions are being made in the budget document?
Riverview is the assumption built in is that they are continuing to pursue certification, continuing to provide an enhanced level of service to successfully comply with the federal requirements and ultimately regain certification.
But as far as the budget goes, how does that? How are you?
As far as the budget goes, you can see that expressed with a variety of additional positions and specific positions and other support services at the hospital. And the purpose of requesting those additional positions and support services is to accelerate compliance.
Thank you.
And question?
Thank you, Mr. Chairman. Just briefly, Commissioner, follow up that question because I'm not sure I understood. So you lost $20 million of funding. This budget assumes we get it back, we don't get it back, we get it back halfway through. Is it the budget that, what assumption is the budget made of that certification money?
The operation of the model of operating a hospital remains the same as it did in 15, moving towards into 16 and 17. So there is a dish draw, but there are also additional, on the spending side and on the additional request side of the ledger, there is a request for additional positions and resources to enhance the level of service of the hospital. So the funding model assumption remains the same as it did in FY15.
Which assumes that the $20 million that we lost, I wasn't on the committee last session, was I understand we lost $20 million of funding? attempting to do whatever we need to do to gain recertification and get that back. And so this budget assumes we are going to get $20 million of federal funding back or not.
The 20 million, I think, is a figure that's been bandied about, but I'm not sure necessarily reflects reality. The fact is that the department is continuing to operate the hospital, is continuing to draw funds, is continuing an ongoing dialogue with CMS, and in the process of ongoing review. So the status in terms of the funding model remains the same.
Quick question, thank you. Looking at the initial budget, if off the top of your head, you know the answer, if not, don't worry about it. But in terms of Department of Conservation and the Forest Rangers, some of them are restructured. What will be the final outcome in numbers when this is over?
In terms of positions or dollars?
Positions.
Off the top, I don't know. We can get you. We
Yeah,
can
like
get that to
some
you.
are being created into this law, whatever you want to call them.
I think that the commissioner is prepared to give you the entire package of the proposals that are in the budget and the rationale behind them. And so you'll obviously have the detail on that, but I think even more importantly, you'll have a presentation of what the policy objectives are.
Thank you.
Did we get all the way through the HHS?
We did in terms of the priorities of what we're looking to fund in terms of offsets. Let me just touch on those as well. There is we have a proposal in the budget to reduce the reimbursement for non-emergency visits. This budget would reimburse providers for non-emergency department visits at a rate equal to that of primary care visits, so the enhanced rate of reimbursement would be removed and they would be reimbursed at the primary care rate. There is a general assistance reform proposal in the budget that would provide a 90% match up front and the smaller 10% match once the municipality reaches 40% of its 6-year GA spending. This eliminates the incentive among cities to pay more in welfare benefits and institutes a new incentive to contain spending. In addition, parity for physician reimbursement. This would bring Medicaid system reimbursing physicians by eliminating the separate facility fee paid to hospital compensated physicians. All doctors will be reimbursed the same amount by Medicaid whether they work in a hospital or a family practice. In addition, in order to fully fund the nursing home and the improved care to the elderly, the budget proposes to align the Medicare savings plan and the drugs for the elderly program eligibility with federal standards. Currently, Maine is one of only 2 states to pay the higher than the federal minimum. Aligning this benefit with nationwide norms will pay for the entire nursing home initiative and all the wait lists outside of Section 21. There is a proposed reduction for home care services for the disabled Mainers, moving them off the wait list. This budget proposes to reduce the provider reimbursement for Section 65 medication management, day treatment, home and community treatment, and wraparound services. And finally, there is a repurpose of funds from the Fund for Healthy Maine to support these priority initiatives with such as the primary care reimbursement rate and home health homes that are designed to improve health outcomes. That would be a transfer of $10 million each year from the Fund for Healthy Maine. I can quickly move through some of the education initiatives. In terms of general purpose aid to education, the level of funding effectively is, the amount of funding is effectively level from 15, so you would see even level in 16 and 17 will offer 2015. In addition, there will be the $10 million that I mentioned earlier to the Maine State Grant Program to allow for an expansion of grant awardees. The University of Maine, there are several initiatives here that impact the university. The increased funding of $9.45 million and the continuance of debt service funding. The University of Maine has received a line of debt service funding of $2.5 million a year. The debt has been retired, but the governor's budget proposes to continue to provide that to help deflect some of their deferred maintenance issues on the campuses of the university system. $5.3 million for research funding, $45,000 for women work in community, and continued distribution of the additional funding flowing from the casino revenue scholarships. The Maine Maritime Academy will be receiving infrastructure funds to invest in the Curtis Hall dormitory heating system, infrastructure to repair the Alpine Student Center roof, and upgrading of the sprinkler system at Leather Hall.
Any questions?
Thank you very much, Mr. Chair. I have a question. You just mentioned that you would be continuing to fund the scholarships under the casino revenue. Under that, you had mentioned the other day that K-12 would be flat funded. Will they continue, though, to receive the money under the casino revenue that was supposed to supplement education? Is that included in there?
That continues to apply.
So the casino revenue would be supplementing the
Yes.
education, so there would be a little bump, not necessarily just flat funded, but they would get that bump.
Effectively, yes.
And I guess under the same theory then, under Dell, you had mentioned that there was the reduction to bring that into line with the elderly program. Again, under the casino revenue, we're supposed to have money dedicated for the drugs for the elderly, and traditionally the Appropriations Committee has taken all of that money. Will we be, and in this budget, will we fund the Dell program through the casino revenue as was intended through the referendum? Or will that money continue to go away also through the casino?
I'll check. I believe that's still. I believe that flows as. I'll get back to you.
Okay, thank you very much.
Sorry, I'll double check just to make sure. Responding off the top of my head is probably not the best thing. Public safety. The governor has continually highlighted Maine's drug problem and has identified funding for additional agents, judges, prosecutors to combat drug crime. This is directly related to the influx of out-of-state drug gangs, which is directly linked to the number of drug crimes committed in Maine. This budget will include providing funding for 7 new drug enforcement agents, providing funding for 4 new assistant attorneys general assigned to the prosecution of drug crimes, provide funding for 4 new district court judge positions to hear and decide drug-related criminal cases, and provide funding for 22 new assistant district attorney positions to process cases faster. And that concludes the handout overview. Obviously, there's a lot in the budget, many individual components. We certainly make sure that the resources are made available to be able to dive into the detail. I wanted to at least make sure you had the basic assumptions, look at the status of the general fund and the impact, and a walkthrough of the major components.
Any questions, committee-wise? Senator Gates?
Thank you, Mr. Chairman. I heard the governor mention a couple of times that he would like to eventually, I guess, eliminate the cascade money which flows from surplus at the end of the budget. Is there anything in this budget proposal which deals with the subject of the cascade?
The pattern of negotiating spending from funds that aren't in hand, I think has been a trend that the government would like to not see continue when it comes to operational costs or program costs. So the purposes of any funds that are available once the books close should be utilized essentially to build the budget stabilization fund and enhance the reserves of the state. We have currently $65 million in the budget stabilization fund. By our current target that we already have as a state self-imposed target, we should be looking at $300 million in that fund. The governor sees that as the priority and does not support seeing program funding embedded in a cascade when, in fact, those funds aren't available to realize until the possibility of a surplus at the end of the day.
Thank you, Mr. Chair. We just have a couple of minutes, but Commissioner Rosen, I was wondering if you could just speak to the emergency bills that you have brought forward. I understand we will not be seeing a supplemental budget, but we will be seeing a variety of emergency bills. Would you speak to what we will have before us at some point?
Certainly. I would certainly like to point out the tax conformity bill. As you know, late in December, Congress extended the tax cuts that were in place in 2013. They decided to extend those in 2014 at the end of the year. The President signed that. Those are now in law. The governor has put forward a bill to conform Maine's tax code the 2014 year to those federal extensions. That would be consistent with what we did as a state in 2013. One of the bills that will be coming before you has been submitted is the conformity bill to achieve that, $16.8 million. The federal filing begins on January 20th. Clearly, the accounting community, the tax software operations, and individual filers in the state of Maine are anxious to have confidence that their returns that are filed this year will be able to align with the guidance that the Maine Revenue Services is extending. So the posture of the administration is to assume conformity, and that is the guidance that's being provided. And it's our hope that the committee will be able to take a look at the tax conformity bill and consider that in as expeditious a manner as you possibly can, and still obviously give it a thorough review. So that would be one that would be a major priority.
Has that been submitted to the advisors?
It has. Yep, that has been sent over. And of the others, the most significant from a dollar impact point of view would be one from the Department of Health and Human Services that relates to the initiative in the current 2015 year of cash management. If you recall, when the budget was adopted, there was a $20 million savings initiative in 2015 directing the department to manage its cash managed payment to providers in a way that would generate $20 million in savings. The difficulty that the department has confronted is that as that proposal was negotiated and finally adopted, there were a significant amount of limitations, restrictions, and challenges that they would have to satisfy before being able to realize those savings. I think they found that unworkable, and they just simply were not able to generate the $20 million in savings because of the difficulty in actually implementing the cash management initiative. So there will be essentially a $20 million request there related to the Department of Health and Human Services budget. We'll get you a list of the others. The others are relatively small in dollars, and we'll give you a complete list of those so that it makes it easier to be able to see. Those are the two significant ones in terms of fiscal impact. If you total them all up, they are well within the fund balance that is available in the budget.
Okay, yes.
Do you have anything for the Department of Corrections and county jails being closed?
No. I think you're referring primarily to Board of Corrections.
Yeah, no.
Further questions? Then I guess by the clock, are you making yourself available to anyone or afterwards here? Or no? Yes, no?
Am I?
Making yourself available for any questions besides what we just posed.
To the members of the committee?
Those who are behind you figuratively.
I'm sure we'll be chatting in the halls.
Yes. Okay. Thank you. So at this stage, we get chairs and leads meeting.
Stay tuned.
Yeah.